Hi, my name's Alexis Witt, and it is May 3rd, 2026. Today we'll be discussing and I'll be presenting on Williams syndrome. It is a genetic disorder that affects multiple systems in the body. Within this presentation, I'll explain the genetic cause of the disease, how it impacts cellular and organ function, and what treatments and healthcare approaches are currently being used to manage it. Williams syndrome is a rare genetic developmental disorder that affects about 1 in every 10,000 people worldwide. The condition is caused by a structural chromosomal mutation, specifically a microdeletion on chromosome 7. It's in a region that's called 7q11.23. This means that small section of genetic material is missing. Because multiple genes are deleted, Williams syndrome impacts several body systems at the same time. It includes the cardiovascular system, the connective tissues, endocrine function, and the nervous system. This disorder develops not only because genes are missing, but also because there's an alteration in the gene expression. This is known as haplosinsufficiency, meaning that only one functioning copy of certain genes remains instead of two normal copies. As a result, the body cannot produce enough of the important proteins such as elastin, which we'll talk about, which contributes to many of the symptoms associated with Williams syndrome. Before discussing the symptoms of Williams syndrome, it's important to understand what normally happens in chromosome 7 and how deletion changes body function. Under normal conditions, chromosome 7 contains more than 1,000 genes that are involved with many important processes, including connective tissue formation, metabolism, cardiovascular function, and brain development. One especially important region is called the 7q11.23. Now, this region contains several critical genes, one being the ELN gene, which produces elastin. It allows for blood vessels to stretch and connective tissues to stretch and remain flexible. Another gene, LIMK1, is associated with visuospatial abilities, while GTF2I is linked to cognitive and behavioral development. Together, these genes help maintain normal cardiovascular structure and healthy neurological development. While in Williams syndrome, a microdeletion occurs in the same region on chromosome 7q11.23. About 26 to 28 genes are deleted, including the ELN gene. Because elastin production is reduced, blood vessels become narrower and less flexible, leading to cardiovascular abnormalities. The loss of other developmental genes also contributes to the distinct cognitive, behavioral, and developmental characteristics commonly seen in individuals with Williams syndrome. These molecular disruptions alter tissue integrity and cellular signaling throughout the body. The missing genes in Williams syndrome disrupt cellular function in two main ways. First, the deletion of the ELN gene reduces production of elastin, which is an important protein found in connective tissue and blood vessel walls. So elastin normally produces flexibility and strength to tissues, while without enough elastin, the structure of smooth muscle cells and blood vessels become abnormal, leading to stiffness and narrowing of arteries. Second, research has shown that Williams syndrome is associated with metabolic abnormalities, meaning that the body's cellular metabolism becomes unbalanced. These changes affect amino acid pathways, fatty acid processing, overall energy homeostasis, which is the body's ability to regulate and maintain stable energy levels. So together, these disruptions affect much more than just one organ system. They interfere with energy balance, biochemical regulation, and the structural integrity of tissues throughout the body. So zooming out a little further and looking at the tissue level, Williams syndrome affects several different types of tissues throughout the body. The greatest damage is seen to vascular tissue, in particular arteries. Because that elastin production is reduced, the arterial walls become thicker and less flexible. The loss of elasticity can lead to narrowing of those arteries or stenosis. It makes it harder for blood to flow properly through the cardiovascular system. Connective tissue are also affected. Individuals with Williams syndrome often experience joint laxity, which means the joints are unusually loose. They may also have low muscle tone and abnormalities in skin texture due to weakened connective tissue structure. In endocrine tissues, the disorder can interfere with calcium regulation, thyroid function, hormone signaling pathways. These disruptions can affect growth, metabolism, and overall hormone balance. The nervous system is also impacted. Studies suggest that there can be a thinning of the myelin sheath, which is the protective covering around these nerve fibers, and they help with signals traveling effectively. In addition, blood vessels in the brain may also lack sufficient elastin, which can alter blood flow and potentially affect neurological function and development. Zooming out even further, at the organ level, Williams syndrome can significantly affect the function of several major organs throughout the body. In the heart, reduced elastin and narrowing blood vessels can restrict normal blood flow, and this could lead to hypertension or high blood pressure, and even more severe cases can contribute to symptoms of heart failure due to increased strain placed on the cardiovascular system. The endocrine organs can also be affected. Many patients experience problems with calcium metabolism, which can lead to elevated calcium levels, especially during infancy. In addition, abnormalities involving growth regulation and thyroid function are common because hormone signaling paths can be disrupted. The kidneys can also be impacted. So these narrowing of the renal arteries, which supply blood to the kidneys, may be also known as renal arterial stenosis. This reduced blood flow can further contribute to high blood pressure and place additional stress on the cardiovascular system. Finally, the brain undergoes structural and developmental changes as well. Research has shown decreases in dendrite size, which can affect communication between neurons. There may also be alterations in their gray matter and overall brain size, contributing to cognitive and behavioral characteristics associated with Williams syndrome. Now let's look at how Williams syndrome affects multiple body systems, starting with the cardiovascular system. Patients with Williams syndrome commonly develop supravelvicular aortic stenosis, or SVAS. So this is a narrowing just above the aortic valve. This happens because they lack elastin, a protein that normally gives blood vessels their flexibility. Without enough elastin, the blood vessels become less elastic, which increases the workload on the heart and can lead to long-term cardiovascular complications. As a result, we often see reduced arterial flexibility and hypertension or high blood pressure. Moving on, the vascular and renal system, Williams syndrome is also associated with systemic hypertension and renal artery stenosis, particularly in childhood. Renal artery stenosis means there is a narrowing in the arteries that supply blood to the kidneys. This can impair blood flow and produce renal perfusion, which contributes to ongoing blood pressure abnormalities. Finally, the endocrine system is also affected. Endocrine disruption in Williams syndrome can impact metabolism, growth, calcium regulation. Patients may experience hypercalcemia, which is an elevated level of calcium in the blood, along with thyroid abnormalities and irregularities in hormone and growth hormone levels. Overall, these system-wide effects highlight the importance of ongoing monitoring and multidisciplinary care in individuals with Williams syndrome. Next, we'll go over some common physical, cardiovascular, developmental, and connective tissue features seen in Williams syndrome. So here I did provide a picture just to kind of see just some of the physical features. Individuals with Williams syndrome often have distinct facial features. These can include a broad forehead or full cheeks, a wide mouth with very full lips, a small chin, and a short nose. In terms of cardiovascular system symptoms, one of the most common conditions is the SVAS, supravelvicular aortic stenosis. So again, that narrowing above the aortic valve, which can lead to heart murmurs, reduced blood flow, hypertension. When we're looking at developmental and behavioral features for these patients with Williams syndrome, we often have developmental delays, so a mild to moderate intellectual disability. However, they are typically known for having strong verbal and social skills, but they may also experience like some anxiety or heightened sensitivity to loud sounds. So finally, connective tissue and growth is also affected. So many individuals will have low muscle tone or the joint laxity and poor coordination. feeding difficulties and slower growth are also common, especially during early childhood. Together, these features help form the overall clinical picture of what a Williams syndrome patient may look like. In this next slide, we'll discuss inheritance patterns and genetic basis for Williams syndrome, along with clinical significance. So, Williams syndrome follows an autosomal dominant inheritance pattern. This means that if the parent has the condition, there's about a 50% chance of passing the genetic deletion onto each child. So, males and females are equally affected. However, it's important to note that most cases are not inherited. Instead, they occur as de novo or spontaneous mutations. So the deletion typically happens during meiosis when chromosomes are being formed through a process called unequal crossover on chromosome 7. Because of this, Williams syndrome is not caused by lifestyle or environmental factors. In terms of clinical significance, the severity of symptoms can vary widely from person to person. Because of the genetic nature of the condition, genetic counseling is strongly recommended for affected individuals and their families. Additionally, early diagnosis and regular monitoring can make a significant difference in improving long-term health outcomes. It is important to note that Williams syndrome is not caused by a failure in cell checkpoints. Instead, it results from chromosomal microdeletion that occurs during meiosis, specifically due to that unequal crossing over that leads to loss of genetic material on chromosome 7. So once the deletion occurs and fertilization takes place, the missing genetic material is present in every cell of the body as the cells continue to divide. It is also important to distinguish this from conditions caused by cell cycle checkpoint defects. Those type of errors are more commonly associated with things like cancers, where cells divide uncontrollably, rather than developmental disorders like Williams syndrome that result from specific genetic deletions. As I mentioned in earlier slides, Williams syndrome is caused by the deletion on chromosome 7, which affects multiple genes. I do have them listed here. So again, ELN gene is responsible for producing elastin. You'll also see that GTF2I genes are associated with characteristics of like cognitive and behavioral traits, where LIMK1 is linked to visual spatial difficulties. And lastly, one I hadn't touched on before is the CLIP2 that also plays a role in neurologic development. So when we're talking about diagnosis and genetic cause of Williams syndrome, to confirm a diagnosis, genetic testing is required. Common methods include FISH or FISH. This is fluorescence in situ hybridization. We also have chromosomal microarray analysis, or CMA, and deletion or duplication testing. So early genetic diagnosis is very important because it allows for earlier medical monitoring and timely developmental interventions, which can significantly improve a patient's outcome. So when looking at Williams syndrome in treatment and management of the condition, it's important to note that there is no cure for Williams syndrome. So when we're looking at management, we can look at it system by system. So starting with cardiovascular management, you can control blood pressure, usually antihypertensive medications, sometimes surgical corrections are needed in severe cases. Routine cardiovascular monitoring is essential for these patients to keep their risk of complications low over time. For developmental and behavioral support, a lot of times speech therapy is commonly used to gain strength for communication skills. Occupational and physical therapy may also improve coordination, daily function. In addition, behavioral and educational support is important for addressing learning difficulties, managing anxieties. When you're also looking at metabolic and endocrine care, regular monitoring of calcium levels, thyroid function is also very important. Some individuals may require endocrine management for growth or hormonal imbalances, along with nutritional support when needed. In terms of current outlook, there is, again, no cure for Williams syndrome. So treatment focuses on managing symptoms and improving overall quality of life. Gene therapy and precision medicine approaches are currently being studied. There are still in the experimental stages, but overall, multidisciplinary approach is key for providing the best care and long-term outcomes for individuals with Williams syndrome. So when we talk about the interventions needed for patients with Williams syndrome, we're talking about dietitians to help manage nutrition, monitor calcium intake. It's especially important due to the risk of hypercalcemia. Physical therapists are also heavily involved. They're helpful for improving strength, coordination, and mobility. Occupational and speech therapists, again, play a key role in improving those fine motor skills and communication. Endocrinology specialists monitor thyroid function, calcium levels, and overall hormone balance. A lot of these professionals that I'm stating now actually work very hand in hand. So when I mention endocrinology specialists, they work hand in hand with dietitians to make sure that calcium intake is monitored closely. Finally, behavioral and educational specialists, along with assisting with managing anxiety, support learning difficulties, and they promote overall developmental progress. So together, this team of multidisciplinary professionals provide comprehensive care and support individuals with Williams syndrome across all aspects of their development. Lastly, when discussing future outlook and emerging research for Williams syndrome, advances in early diagnosis and medical care have also helped more individuals live into adulthood that have Williams syndrome. Identifying the condition earlier does allow for better monitoring and more timely interventions. A multidisciplinary approach where specialists from different fields work together has also played a major role in improving the quality of life and overall function in patients with Williams syndrome. In terms of current research, scientists are working to better understand how the deletion on chromosome 7 affects brain development. There is also ongoing research into social and behavioral characteristics seen in individuals with Williams syndrome. Other areas of focus include improving cardiovascular treatments and investigating metabolic abnormalities, along with identifying potential biomarkers. So looking ahead, there are several promising therapeutic possibilities. These include gene-based therapies, precision medicine approaches, and targeted molecular interventions. While these are still in development, they offer hope for a more personalized and effective treatment in the future. And thank you for watching my presentation.